Hello, my name is Prudence and welcome again to Pretty Noir Health. I had a question from a viewer who wanted to know what I meant when I talked about metabolic syndrome. Metabolic syndrome is defined as a cluster of conditions that when they exist together predisposes a patient or a person to dropping dead from a heart attack, a stroke, or developing diabetes down the line. It was formerly known as Syndrome X. 5 things make up metabolic syndrome. If you have a fasting blood glucose that is greater than 100, if you have triglyceride levels that are greater than 150, if you have a blood pressure reading that is greater than 130/85, for men, if your waist circumference is greater than 40, and for women, if it's greater than 35, for men, if you have your HDL levels that are less than 40, and for women, if you have HDL levels that are less than 50, they predispose you to having metabolic syndrome. That means you can drop dead from a stroke, from a heart attack, and develop diabetes down the line. I have a picture that kind of depicts what I'm talking about. I'm going to make myself a little smaller here. Please bear with me. I'm a visual learner, so I understand if people want to see pictures. I have 5 things, all 5 things listed here. The low levels of HDL, that's the good cholesterol. If you have elevated blood glucose levels, that's greater than 100. That's elevation is greater than 100 for metabolic syndrome. If you have high blood pressure, I'm not talking about blood pressures of the 140/90s, it's 130/85. And then the excess weight around the abdomen. It's one thing to be like big all over, and then it's another thing, the risk factor for metabolic syndrome, if you carry your weight around your abdomen. And for men, if it's greater than 40, and for women, if it's greater than 35, right? And then also elevated triglyceride levels, greater than 150 for both sexes. How do you decrease your risk for developing metabolic syndrome? As you can see, it's very easy to fall into at least 3 of these categories, right? It tells us that if we lose 5% of our body weight, it decreases our chances of getting metabolic syndrome. It also informs us that if we work out, like I always talk about the TLCs, if you work out at least 40 minutes 3 times a week, if you eat healthier, less fatty food, less animal-based products, and also if you avoid smoking in general, like if you're a smoker, quit smoking, and also avoid secondhand smoke. All these will kind of decrease your risk for developing metabolic syndrome. Then again, there are people that are predisposed to having like heart disease, diabetes based on their genetics, but then we can fight it. Like we can do our part to prevent like from flipping the gene switch off, right? If you're overweight, losing 5% of your body weight would decrease your risk for developing metabolic syndrome. If you notice that anything is becoming unusual, if you have difficulty, if you need help, please talk to a healthcare worker, a healthcare provider, your primary care provider. If you have concerns, it's easier to catch a problem earlier and fix it than to wait for it to get bad and then try to play catch up. Again, it is Pretty Noir Health. If you have any questions, please ask me. Don't forget to subscribe. Don't forget to like. Don't forget to share. And also leave your comments. I love the comments, okay? Thank you so much. And again, always come back, put your notification bell on. That way, if I drop something new, you will be notified. Thank you.